So, what are some of the effective strategies that you've done in your line of work when you're facing people who have this not in my backyard mentality or this resistance, saying that no, 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 they're not humans, they don't count, right? They're not part of this society, they don't contribute, they don't pay taxes. What are some of the more effective strategies you have used? Because as you know, probably more than anyone, that convincing does not always work.
Yeah. So I think some people think with their heads, some people think with their hearts. And in convincing, your job is to connect the two. For the people that think with their heads, then you're more likely to come to them with certain facts and figures in order to make a convincing argument. And so, for example, if I'm speaking to hospital administration on why they need to care about people experiencing homelessness who are either costing them so much money because they're in and out of the EDs and the hospital, or they're not accessing care at all and dying on the streets, then you come to them with facts and figures on high readmission rates, high length of stays, or maybe they care about, people dying in their 40s and 50s. And so that's how you would speak to them. And then other people just respond to human suffering and the desire to relieve suffering. So it really comes down to our motivations in street medicine. And I found that street medicine providers, because we all share these similarities, and it's not, of course, not unique to street medicine providers, but I found three things that motivate us. Number one is a sense of duty, where we say, I'm a doctor, I'm a PA, I'm a nurse, I'm a medical professional, and my job is to heal people who are sick. And so the people experiencing, especially unsheltered homelessness, who are much sicker than those who are sheltered, they say, that's it, I'm going to them, I'm going to serve them. Others are motivated by a sense of justice, where they see that this grave injustice has been done to them, and they want to right that wrong. And then the third one is this profound sense of love, where they see that people are suffering and they want to relieve that suffering. And I think we all have elements of those three in us with, different proportions. Like for me, I'm much more motivated by love. It wasn't always that way. That has shifted in my career. But other people have their own motivations.
Let's just stay on that train real quick. What do you mean by it has shifted in your career?
So I think when I started out, I was much more motivated by duty, where, I witnessed a lot of people who were super sick on the street, that there was really nowhere for them to get care. And they weren't able to access brick and mortar facilities. So things like cancer or heart disease were just left untreated, and they died on the street. And I remember, this was in Allentown, and they were not doing autopsies on people experiencing homelessness because there was no family to report it back to. So a lot of folks died with no name and no cause of death. And so where it started with me just being like, we have to treat everyone's illnesses. Let's go do that. They're really sick. Spending time with them and getting to know them, found out that they were really beautiful people and some of the most authentic and genuine people that I knew. Some of them became some of my greatest teachers. And to think that some of them died without a name, I think shifted to what motivated me over my career.
Yeah, thanks for sharing. Yeah, that makes a lot of sense. I feel like we can gain experiences and exposure through reading, through proxies, through vicariously, through other stories. But the best way is probably through direct exposure, by actually having this conversation with them, stripping away the mask and prejudice and biases of what we think they are or what we perceive them as, but just talking human to human, which I know is like the whole ethos and how the mission statements and philosophy, how street medicine team operates. So for some more context for the listeners, Brett, what is street medicine and why do you think it's a really important but little known work? Because until I read that LA Times article by you in 2020, I didn't even know what street medicine was. And I'm pretty deep into the whole clinical field, and I also subscribe to love over fear. right? So what is street medicine and why is it a really important topic?
Yeah. So just, very brief for the listener, street medicine is the delivery of healthcare to people experiencing unsheltered homelessness in their environment. So the whole idea is that people experiencing unsheltered homelessness just can't access healthcare the way the rest of us do. So we go to them in a very assertive way with the goal of first delivering a tender love, as you said. And then after that, the same quality of healthcare on the street that you would expect in a brick and mortar clinic. And we know that healthcare is much more than the doctor's visit. So we dispense medications, draw labs, we can do ultrasound on the street, EKGs on the street. We do it with a pickup truck and backpacks. And so we go through walking rounds. The motto is to go to the people, to suspend our reality and meet them in their reality where they feel most comfortable. And so it is important to differentiate street medicine from mobile medicine or RV medicine, which is great. And there's many people who are served through that way. But the difference is obviously visual. We're on the street in the encampment there in an RV, but also philosophical, where we want to intentionally flip the power dynamic in their favor, where they feel most comfortable. And even if we drive in proximity to them, and this was a lesson I learned very early, we're still taking them out of their environment and bringing them into ours, where we've probably even licensed. And that flips that power dynamic back in our favor, which is not where we want.